February is American Heart Month, and all month long we've been taking a closer look at heart care here in Rochester, and we are wrapping up the month by looking at some of the advances being made in heart care. We are fortunate, joined by Dr. Gerald Gacioch, a cardiologist at the Sands Constellation Heart Institute. Welcome and good morning.
Good morning.
Let's just recap for people who, might not have seen the other segments we've done. What is heart disease?
Heart disease is a very broad category. Most people think about heart attacks and coronary disease, which is, a large part of it. But it also encompasses things like heart failure and valvular disease. So it's a very broad category.
And we're talking about, I know in the past, that just because you have heart disease or heart failure doesn't necessarily mean that it's a death sentence. There are so many advances that are being made right here that can help people.
Oh, you're absolutely right. In the past, it was felt to be a death sentence, or that you'd be crippled, we'd call cardiac cripples. Now people with heart disease are living into their 80s, 90s, living very active lifestyles. And it's a combination of things. I think we know a lot more about prevention now than we did in the past. But then for people who've developed overt disease, we have just wonderful treatments.
Yeah, what are some of those treatments?
So everything from fixing the coronaries with caths and bypasses, to replacing valves now with just a poke in the leg instead of open heart surgery, to people with advanced heart failure now living very long and active lives instead of being confined to the chair.
Yeah, and we spoke with another cardiologist last week about that, how you don't have to just have this massive operation. The recovery time is shorter now, all thanks to technology.
Yeah, no, it's amazing. I've had patients in their 90s who come in one day, have the procedure, and walk out the next day, which again is amazing. And people who prior to the procedures might only be able to walk to the kitchen, that's all they could do. Now they're out shopping, they're out doing things with their family, they're playing with their grandkids, which they haven't been able to do for years.
Yeah, I know you reference patients maybe in their 80s or 90s, but who's most at risk for heart failure?
Well, for heart disease in general, it can strike at any age. My brother, for example, had a heart attack at age 35. So really one of the messages to get out to the Rochester population today is a lot of this is under your control. There's a lot of things you can do to prevent becoming a cardiac patient. And then if you do become a cardiac patient, we'll help fix things. But again, a lot of it is up to their lifestyle choices on how good they're going to do. Yeah,
what can we do to prevent this from taking a toll on us?
Main things are sort of the basics. Is smoking is very bad, leads to a lot of heart trouble. One of the big problems in our area is people are pretty sedentary, especially this time of year. People don't get outside, don't exercise. So one of the messages to get out is get out there and get 20, 30 minutes of purposeful exercise each day. And then you are what you eat. And so eating healthy, making sure that you're getting your veggies, your salads, fruit, staying away from the fried and greasy.
Yeah.
And then obviously you want to know your numbers. If you're diabetic, you want to get that under control. If you're like me with high blood pressure, you want to make sure you take your medicines and stay under control. And then knowing your cholesterol numbers and having that under control. Yeah,
that information informing yourself and how you can stay ahead of things. And it's interesting, we think of Valentine's Day in the month of February, and so we're taking time to love ourselves and know what you need to do to take care of yourself. Good resources and technology that's advancing here in our own backyard. So, Doctor, we thank you so much for stopping by and sharing with us this morning. Where can people go if they want to find out more information or just need maybe a checkup?
Yep. The American Heart Association website is a fantastic resource. Here in Rochester, we're incredibly lucky. Both health systems have very good resources that you can use.
Yep. All right. Thank you so much.